My name is Steve Carlson. I am an independent living specialist with North Country Independent Living. I live in Trigo, Wisconsin. And I just wanted to really kind of give the larger backdrop to some of what my colleagues explained today, that Medicaid is an absolutely crucial program here in the state of Wisconsin. It's the largest health insurance plan in Wisconsin, covering a wide variety of low-income people, people with disabilities, and elderly people. It also funds a number of very crucial programs that helps a lot of those folks stay in the community. And on a personal note, when the governor refused the Medicaid money here several years ago, and as he's done with every subsequent budget, one of my stepdaughters lost her Badger Care as a result. She was able to get a plan on the Affordable Care Act, but up here in the rural part of the state, there's much less competition. She got generous federal subsidies to get a plan, but she has a deductible that's actually prohibitive in terms of her overall income. So it's been very tough on her. She's a hard-working young woman raising 2 boys on her own, does a very good job that way. I'm grateful my grandsons can stay on Badger Care. But she's lost her health insurance, and it's been a big strain in her life. She also lost her doctor as a result. She had to go to a network. When under Badger Care, you can go just about anywhere. And I guess the crux of my testimony that I wanted to impress upon this committee, and I don't want to make this a partisan issue, but given that we have Republicans in majorities in both chambers and in the governor's mansion, is that 4 years ago I was working on this issue in the Chippewa Valley, and at a listening session in Elk Mound, almost exactly 4 years ago, State Senator Terry Moulton, a Republican, gave a very eloquent argument about why we should be taking that money. 2 weeks later, State Senator Jerry Petrowski, a Republican from the Wausau area, these are 2 senators that are also representing the northern part of the state, gave an even more eloquent argument about why we should be taking that money to strengthen just a crucial program here in the state. One last note, I don't know the degree to which this has been analyzed or articulated carefully, but my hunch is that the single biggest impediment to the passage of the American Health Care Act was probably behind-the-scenes pressure from Republican governors who did take the Medicaid money and did not want to face the consequences of seeing hundreds of thousands of their constituents and the residents in their state losing their health insurance. Going to the doctor is not a partisan issue. It's an issue of humanity, civility, compassion, and just being decent. So it's never too late. This committee should go back to Madison and tell Governor Walker the people of the Northland need health insurance. They need the Medicaid program expanded.